Today we'll be discussing Cheilosis, and Cheilosis is still a medical condition known as what? Angular stomatitis. And this condition is still known as what? Angular cheilitis. Okay, so we get to actually divert to Cheilosis because I was doing iron deficiency anemia and I saw that Cheilosis was like a sign, okay, for iron deficiency anemia. So I just saw it like, okay, let me make a video on this concept. Okay, so what is our focus for today? Discuss Cheilosis, also known as angular stomatitis, also known as what? Angular cheilitis. So discussing this condition, we'll be defining it. We'll be talking about the possible causes, okay? Then we'll be talking about the symptoms of angular stomatitis. Then we'll be talking about the possible treatment of this angular stomatitis, okay? It's also known by those other names, but most of the times, most people call it angular stomatitis though. So guys, angular stomatitis, also known as what? Angular cheilitis, also known as Cheilosis, is a condition characterized by inflammation of the corners of the mouth. So it is a common condition that can be caused by a variety of factors, right? So it's not just, I actually saw this concept when I was reading about iron deficiency and anemia, but it is not. Iron deficiency anemia is just one cause. Do you understand? So there are several other causes of angular stomatitis or angular cheilitis. All right. So you can't only attribute it to iron deficiency. So guys, the possible causes of this angular stomatitis or angular cheilitis include what? Fungal infection, include bacterial infections by Staphylococcus. Fungal infections could be by Candida. Okay. Then we have vitamin deficiency like riboflavin and vitamin B12 deficiency. Then we have iron deficiency. Okay. Then we have poor oral hygiene. Okay. It could be that you have a poor oral hygiene, and this can also lead to angular stomatitis. Then we have ill-fitting dentures. Could be some surgery, maybe they put you some new set of teeth, so they are ill-fitting, okay, and it could cause inflammations to the side of the mouth. Then we have allergies. It could be that you actually reacted to an allergic stuff. Do you understand? Then hormonal changes. Okay, this could be due to hormonal changes. Nutritional deficiencies could be that you are not really feeding well. Okay, and all this can reduce to an inflammation to the side of the mouth. Okay, yeah. At least you guys saw a picture, right? So angular stomatitis can occur in the elderly and in children. Okay, so moving to the symptoms of the disease condition, what are the symptoms of angular stomatitis? We have cracking or fissures of the corners of the mouth, which is the most common symptom. Okay, cracking or fissuring, sorry, cracking or fissuring of the corners of the mouth. Then we have redness and inflammation. That region of the body will be red and will be inflamed. Then we have itching and burning sensation. We have difficulty in eating or speaking. This is because you have a wound here. It is an inflammation, it's paining you, so you won't like to actually open your mouth too much. Do you understand? So you have difficulty in eating and speaking. Yellow and white patches on the lips. Okay, so this can extend to the lips where you have yellow and white patches on the lips. What are the possible treatments for angular stomatitis, also known as what? Angular cheilitis, also known as what? Cheilosis. We have topical antifungal or antibacterial creams. All right, so this is topical. Topical route of drug administration is basically you applying the drug directly to the area of disease. Do you understand? Then oral antifungal and antibacterial medication, you can actually still swallow the drug so that it will go into the body and shoot it up all over the body, so that if there's any other bacterial stuff or fungal stuff hidden anywhere in the body, it will destroy it. Then we have vitamin supplements. We have iron supplements in times of what? Iron deficiency. Then the individuals should practice good oral hygiene. Practice like what? Brushing, flossing, and rinsing the mouth. Then adjust or replace ill-fitting dentures. That's basically if they have gave you some new set of teeth and they're not fitting well, you should adjust this. Okay. Then avoid irritants. Irritants like what? Spicy food and acidic food. You should avoid them. All right. So, guys, it is important to consult a healthcare professional for proper diagnosis and treatment, as angular stomatitis can be a symptom of an underlying condition. Okay. So, guys, this is it about angular stomatitis, also known as what angular cheilitis, also known as what Cheilosis. Okay. So, I hope you guys enjoy this lecture. I'll be seeing you guys in the next.